meet the child where they're at. So we see a lot of different reasons as to why students choose to come to Fusion. But one of those reasons is ADHD. So you can imagine that it's a very important to discuss today. I'm going to introduce you to Colleen Russo, who's from the Houston Hub. So Colleen, why don't you say a little bit about yourself and hello?
Sure. Thanks so much, Elizabeth. I'm Colleen Russo, and I am the Executive Director and founder of the Hub Houston. We're an educational young people relationship-centered program in the Spring Branch area. And we have a high school. We have a post-grad program, which is called Life 101, which is for 18-year-olds and above. And we also have Club Hub, which is purely a social being group for young people 18 and over, that in the evenings, and it's just for socialness. Like where do you go when people say, hey, where were you last night? I missed you. And that's what our guides need. We deal with all neurological differences. We don't just pick autism or ADHD, but we do, my own brain included, have a lot of ADHD on our campus. And this is a wonderful topic, and I'm really proud of Dr. Ron and all the work he's done in this area. And I'm really delighted to be here, and welcome to everyone here. And awesome. I would like to introduce Ms. Pam Esser from ADD/SR, and she has a lot of exciting news to share with us also.
My exciting news right now is I'm trying to text somebody in my grab my dog because he just stole a whole thing of dog treats as I'm sitting here. Sorry. I may not be the ADHD one in the family, but I live an ADHD life. Even my dog is. Hi, I'm Pam Esser. I'm Executive Director of ADA Southern Region. And we've been around since 1987. So we are good at what we do. How's that? We do have free support groups. Right now we're doing 3 virtual groups most months. At least one is always geared more for adults, and the other 2 tend to be more parent topics, but not necessarily. So always check those out. And then of course we're involved with this lovely group once a month that we're really pleased to be part of. But our big news is Russell Barkley. And if you do not know who Russell Barkley is, look him up, you'll find a lot. Russell Barkley is one of the first speakers I heard when my kids were diagnosed, oh gosh, 35 years ago. And he is just considered one of the all-time ADHD experts. And he's going to address life expectancy, health outcomes, all of those things we're eager to know about when our kids are small. It may be not as much trouble, or we're not sure hike. So this is a really hard look maybe at what the disability can cause, so that you're more prepared, and making it more obvious about what you need to plan for. And also I think just to be aware of what could happen. So you're a little bit on top of it. A lot of things about ADHD are very positive, which I know you're going to hear about today. But I also know that oftentimes we're caught off guard by some of the myths and things that are still floating out there about ADHD. So I put our website in the chat. The tickets are from $40 to $60. And it's a bargain to get to see him like that. It'll be a 3-hour presentation on Saturday, January 23rd. So please check out not only the presentation, but our other support groups, and we will have events throughout the year. So please check us out. We would love to be in your pocket of referrals and people that you send people on to with ADHD. Thank you.
Thank you, Pam. Now I'm going to switch it over to Dr. Ron to present. We are so lucky to hear him talk today. This is such a prevalent topic. And I think there's a lot of misguided information about ADHD and a lot of new information we're going to learn today. So take it over, Dr. Ron.
Well, welcome everybody. This is a large group, and I'm doing my best to admit people as they come into the waiting room, so I'm probably a little distracted here, but of course, you know I have ADHD, so we'll get into it right now. I can multitask. Hang on. There you go. Okay, let's get share screen. Okay, you guys see my PowerPoint out there? Okay, great. Good head shaking going on. Let me blow it up. Okay, everybody. You know, I put this together here in the last week, and I really enjoyed it. It's a different approach to ADHD, as I've done with Pam for many years. I presented at their conferences, and really love doing it. And so this is approaching it from a more of a biopsychosocial perspective. And we get in. I've got about 12 slides here, so we'll go through it quite quickly, and then we'll open it up for discussion afterwards. Okay, all ADHD is not bad. Okay, we want to focus on the positives. I was directed by Pam that we really need to do it this way, and I said, that sounds like a great idea, Miss Pam. You know, ADHD provides those with a superior drive and ability to hyper-focus. In addition to that, resilience, the ability to take change, and modify whatever's going on in your life to be able to step up and address what needs to be addressed at the point in time. Of course, a sparkling personality. I do admit that I love to hang out with ADHD people because normally I like this part about being generous and a strong sense of fairness. I do find that is probably within the traits of an ADHD person. Ingenuity. We always have to come up with a different way to do things. That's just within our nature. Willing to take risk and spontaneity. Those who never risk greatly never accomplish greatly. One thing about taking risk is ADHD people, I don't know if I put this down, I don't think I did, but no doesn't bother us. We can run up against a problem and find a way around it. A great sense of humor, you've got to have that. And I like this one, the last of the romantics. And engaging conversational skills, as you can see, the gift of gab is with all of us in this little beautiful group of ours. Compassion, persistence, and a superior creativity, and a different perspective. We are really always outside the box. Contagious motivation, I do love to motivate people. And being highly organized, punctual, and generally responsible. I am a stickler on being punctual and getting everything organized. But then again, you got to know your shortcomings and be able to call upon your wonderful people on this team. Sorry, somebody needs to tell me to mute my phone. Can you do that, Miss Alexandra? Okay. Now let's get on to not all ADHD is equal. Biological causes. I'm going to approach it first from the biology. So there are many biological, neurological, and social challenges that can produce focus and attention and impulsivity and hyperactivity issues. Now, on the physical side, we're looking at encephalopathy. Encephalopathy is just a big word that means organically messed up brain for some reason. For some reason, the body's not supporting the brain. And the primary things that we find in our practice over the last, I've been here going on 18 years, is metabolic, toxic, and anoxic. Now, metabolic has to do, we've actually found several children who have a specific EEG signature that looks like, it turns out to be Hashimoto's thyroiditis. Unbeknownst to their family, the thyroid in these young people were malfunctioning, and it was causing this type of encephalopathy. Toxic. We think about most of the encephalopathies are lead poisoning, and we don't really consider lead poisoning around here as as much of a toxin issue. But we recently got a young child that was down in Galveston, And Galveston has a lot of old structures, a lot of old houses, and they use lead in the paint back then. And so we've actually had a boy come up positive for toxins. We get a lot of referrals in from Beaumont as well. And with the refineries there's a lot of toxins in refineries, around refineries. And this is something that we definitely need to look for and look, when we have somebody that's coming from those areas. And anoxic is without oxygen, meaning that at nighttime when these children are sleeping, they're not getting enough oxygen for their brains to fully develop or mature as they're supposed to over time. And we've actually had, when they come back with this, when my EEG electroencephalographer comes back and says it's encephalopathy, possibly metabolic, toxic, or anoxic, I've got to just figure out which one it is. And so I had two little boys that came in to me, and one of them was 6 and one was 8, little skinny boys. And they both had sleep issues. So they came back with encephalopathy. I said, okay, let's have your sleep checked. And so we sent them off to a sleep lab. And sure enough, their tonsils and adenoids were so large that they couldn't get enough oxygen at night to have their brain mature at the right age. At the right speed. So we ended up on them actually having the tonsils and adenoids removed, thanks to a really great ear, nose, and throat doc. And within 3 months, their brains had sped up to normal speed and ADHD symptoms were going away. And then traumatic, we always hear about the football players, chronic traumatic encephalopathy. Well, that's what this is, multiple concussions. We don't see a lot of that except in the football. Oh, there's somebody else trying to get in. Okay, got that person. All right, so let's go to the neurological causes of ADHD symptoms. Now, a lot of these words are going to be kind of weird, and I'll explain it the best I can. I've got a pamphlet out right now that translates it into mom speak, and I'd like to send it to all of you who really need to. But the alpha is a timing frequency of your brain. It's how fast your brain actually times the information to get to where it needs to be on time. And you can look at the alpha speed as maybe something like a metronome. And when it's real slow, that's one of the findings that we have that can cause ADHD symptoms. And it's actually the one that we call it central nervous system hypoarousal, underarousal. The next is the high theta beta ratio. This is probably the most common that we see, and most common we understand. The real, not so much hyperactive as they are distractible. And we have one of our QEEG tests that analysis we do is to analyze the theta versus the beta. The theta is a brainwave that's slow, and the beta is a brainwave that's fast. And so when we have the ratio very high, then we have too much slow wave and not enough fast wave. So this is something that's pretty common. Beta spindles are an anxiety-based ADHD, completely different. It'll produce a lot of anxiety that actually has the person lack the ability to focus and attend. Then we've got the other part, it's called anterior hypocoherent alpha. When the alpha is in the front of the brain and it's too similar, it's doing the same thing at the same time on the left and the right hemispheres, well, the default of the brain is always going to be with survival. And so that's going to be emotionally. So when they're challenged, they're going to use the emotional side of their brain to deal with challenge. But these are also the very, very artistic brains, the ones that can think up things, can paint, can draw, can compose, can do all this other kind of stuff. And it's really kind of cool. These are really artistic people, not autistic, but artistic. And they tend to get distracted more by their own thoughts than they do by a butterfly flying by, for instance. And then the last one, my one that I've studied and published more on than anything else, is isolated epileptiform activity. It's like what we say silent seizures. And so these things, this type of activity can be identified in the EEG, but it has to normally be done by an electroencephalographer or somebody board certified to read EEGs, and not just your neurologist. Most neurologists will overlook it and say it's normal. But we found this activity is very distracting, because if the brain is misfiring, you're losing that continuity of focus. And so that's where this comes in. Now let's look at the social causes. Okay, and I'm going to go right straight in the very beginning to excessive video gaming. If your child is not ADHD, excessive video gaming will make them ADHD. If they are ADHD, the video gaming will make them worse. And that is, the Japanese have done a lot of work on this. They found that when they took heavy gamers off the video games, their brains did not go back and change back to normal. They stayed with the same slow frequency in the front of their brain. So that's one thing that we know that can cause a lot of ADHD symptoms. And I'm a veteran of Vietnam and Desert Storm, so I can tell you for sure, coming back from those two wars, I was very ADD at the time because, you know, it was hard to focus on anything. So I'm putting in here combat or war because all the military guys coming back will have more difficulty with focus and attention. Abuse is another way, because if you're being abused in your house or bullied or whatever, of course it's hard to focus. And then the last one I put in here is extremes of heat, cold, or pain. Now, as you know, that if you're living in an area and you lose your heating system and it's cold as it has been the past few days, it'd be hard to focus if you're really hypothermic. The same thing goes for if you're, you know, having your air conditioner goes out, or if you're in a lot of pain for some reason. So, you know, a lot of people who have chronic pain issues will have a difficulty with focus, even if they don't really traditionally have the normal ADHD. All right. So psychiatric medication is ineffective for encephalopathy. If your body's not supporting your brain, nothing we throw at it with medicine will work. So only an electroencephalogram can identify encephalopathy. So I want to make that distinction because there's other people out there doing symptoms or doing QEEGs, but unless they have it read by electroencephalographer, the quantitative EEG brain maps won't identify encephalopathy. So that's a distinction I like to make. I'm always encouraging everybody to send their data off and have it analyzed. We don't want to miss something like this. Low voltage slow EEGs is what they'll come back with, are suggestive of encephalopathy, but they don't know what the etiology is. Well, if we go in down my list of questions, and I can come up and I can say, well, I think we're looking at an issue with metabolic or toxic issue. We can send them off to their doc, and the doc can say, okay, let's run a panel and let's do a tox screen. And let's run a full metabolic panel, meaning they're going to check the thyroid from one end to another. Anoxic, like I said before, a sleep study is needed. And then traumatic, we can always consider imaging for something like this. But so this is all on the physical side. And again, psychiatric medication is not going to help. And we did a study of 1,233 people, and I think our rate of encephalopathy was right at about 12%. So just giving you the data on the number of people we see that actually come back with encephalopathy. A little bit higher on children if you separate the adults out, but something to be aware of. Medication. Now let's get into fun stuff of medication. I'm going to see if I can move all these heads out of the way so I can look at my complete slide here. That worked. Amphetamine type stimulants work great to increase norepinephrine, which helps speed the brain up in the slow alpha subtype ADHD. Makes sense. We know what each medication will do. And so if we have a brain that's slow, central nervous system hypoarousal, and we put a stimulant on there, amphetamine type, it works primarily on norepinephrine to increase the norepinephrine. I didn't mention Strattera, which is a norepinephrine reuptake inhibitor, but it's in that same vein. It doesn't add in any norepinephrine, but what it does is help to block the uptake of it. So that would be also in that one, in those that have slow alpha speed. These are the kids that are usually, we find them less mature than their peers. And they really are a lot of hyperactivity in them, because if they're not hyperactive, they're falling asleep. So just something to be aware of. The methylphenidate type stimulants work best to reduce the theta and the high theta beta ratio subtype. This has to do more with the dopamine issue than it has to do with norepinephrine. So it's a slowing that we can see right in the frontal central midline that enables us to identify this subtype and know that, well, methylphenidate type stimulants will probably work real well in this. Now, SSRI, selective serotonin reuptake inhibitors, work to reduce the anterior hypocoherent subtype. They do this because what we found in this subtype is that the individuals are not making serotonin as they should. We can get into a whole discussion on the MTHFR gene and why a person's brain wouldn't be making serotonin, but that's outside the scope of this hour we're working on, so we'll pick that up at another time. Antiepileptics, anti-seizure medications work to reduce the excessive beta and beta spindle subtypes, and also the antiepileptics work to stabilize the brain in the isolated epileptic form discharge subtype. We actually did a study where we put 76 people between the ages of 4 and 52 on antiepileptic drugs when we found spikes identified in their EEG by electroencephalographer. And we ended up having an improvement of 85% over their baseline symptoms that they came in with. So it's, and they all had failed multiple attempts at other medications. What we need to know, though, if they have the isolated epileptic form discharges, that amphetamines, methylphenidates, SSRIs, SNRIs, and especially antipsychotics all lower seizure threshold and can make the brain worse. So if your child has been put on one of these medications and they got worse or they had some severe reactions to it or whatever, likely they've got these discharges. We just did a big study published in the journal, European Journal of Child and Adolescent Psychiatry, and we found that nearly 40% of all children between the ages of 4 and 18 was our study group, have these actual discharges, and we should consider a trial on anti-epileptic drug before we put them before we try to work with any of the other issues that they may be having, because we have to have something stabilize the brain before we can treat something else that's going wrong. It's a lot to it. It's very complex. I know I'm rushing through it, but I want to answer your questions. Okay. Psychotherapy can help resolve social issues. Video gaming addiction needs addiction treatment. Bottom line, if it is destroying their lives, if it's destroying their school, if it's destroying the relationship with their families, if they're isolating themselves to the room, I don't care if it's alcohol, drugs, or video gaming, it needs to be treated like an addiction. Combat and war, PTSD treatment, there's lots of them out there to help the guys get in their brains, get back from the war. Abuse, well, if it's child abuse or elder abuse, Child Protective Services or Adult Protective Services is an intervention that needs to be, it has to be done and reported for any mental health professional or any teacher working with these populations. And PTSD treatment for the abuse, of course. And extremes of heat, cold, or pain, social intervention to improve the patient's environment. Let's hook them up with some sort of get them an air conditioning going. That's where my social work background comes. I'll find ways to connect people with different sources out there in order to, or resources to get them what they need. So neurofeedback, let's talk about that briefly. Neurofeedback is a way to train the brain to a more functional state, and it helps, and we find it an option for each of these subtypes. That thus eliminates the need for medication. And a lot of people don't want to try medication. That's all well and good. So we have an option for that. Now, there are certain times when neurofeedback, because of its nature, takes a much longer time to take effect than a medication. If a person's in crisis and they're suicidal, you're going to have to use medication first. But it can be used in conjunction with neurofeedback, and eventually the medication eliminated. So that would be always our goal, is to get somebody's brain retuned properly so that they don't need medication. Neurofeedback is a non-invasive treatment for ADHD that cannot address encephalopathy subtypes, and it cannot address social subtypes. So it has its limitations, and it's not a standalone treatment. Neurofeedback was never designed to be a standalone treatment. You should always, if it's a child, have family therapy and have individual therapy for that child to bring it all together. We can tune the brain to be a better brain, but we're not doing it to make them a better video gamer, even though it would. So kind of see where I'm going with that. Takeaways. ADHD is a very complex diagnosis with a variety of causes. The National Institute of Mental Health in 2012 came out and said, Dr. Thomas Insel came out and said that the DSM, the Diagnosis and Statistics Manual that we use, is not a valid instrument and they're no longer going to fund research based upon its categorization. He pulled the carpet out from every therapist, from every psychologist, from every psychiatrist, and he said, we need some imaging technique, we need genetics, we need something to tell us what's causing the symptoms, not just a collection of symptoms. When you diagnose in mental health now, if you have a collection of XYZ, a number of XYZ symptoms, then you can be diagnosed with that. But it's not truly a diagnosis. ADHD, as we've seen, focus and attention and hyperactivity and impulsivity issues can be caused from a wide variety of things. So the diagnosis as ADHD doesn't tell us what would be successful to treat it. And I'm sure you guys have ran up against this in your lives. So the identifying the biological cause is critical and starts with an EEG. You cannot do it without an EEG. Identifying the neurological causes of EEG requires an EEG and a quantitative EEG brain map, because we have to have a brain map to tell us how significant a finding is over time. And then identifying the social causes of ADHD is the job of a good therapist. I just like to leave it right there with that. So that's the end of this. We can go into questions now, and I did get some questions. And I'd like to address these up front since they were sent to me ahead of time. And you guys always can send me questions ahead of time. I love this. My question, she says, as a board certified neurotherapist, do you believe the goal of a gastrointestinal, what do you believe in the role of gastrointestinal health and the supportive diets in helping patients diagnosed with ADHD gain better health through gut health? Absolutely. Absolutely. Underlying a lot of these issues with children is their diets. I mean, high sugar, high carb intake. If you want a brain to malfunction, sleep's number one, intake's number two. So if they're not eating, they're skipping meals, or they're eating a lot of sugars and carbs, hypoglycemia is a big deal, and it's the brain does not work well. I'm not just saying for ADHD brains, I'm saying all brains. And sleep, like I say, is number one, and number two is stimulation. And the hyperstimulation you get from, can be from concerts, it can be from a pep rally, but it also can be from excessive video gaming. That's expensive. So in gut health answer, yes, definitely, we want to check that. I do work with functional medicine docs, and I love working with them because that's one end. Now, I have actually seen one of my patients who was in his 20s, early 20s, that ended up having all sorts of ADHD issues. And when we finally identified that he had celiac and got him off of gluten, world of change in this individual. So yes, I have seen it work magically in some people, but for the most part, I haven't seen that that it's a cure-all. But we got to think of our brains as your engine or your car. You have to take care of it. You have to feed it properly. You have to rest it properly. It's something that we need to take care of. And then the next question is if there's an answer, if this answer is yes, what specific nutritional or dietary interventions do you condone? Probably a keto diet, more towards that, is something we have found that is better for all brains. Again, we want to keep the blood sugar stable. We don't want big swings of blood sugar. So whatever that diet is would be fine. And it sounds like this person can make a lot of recommendations in that area. Are the effects of biofeedback / neurofeedback therapies long lasting? The effects that we see in the neurofeedback, the 10-year follow-up studies have found that the changes we make in neurofeedback stay and are permanent unless we have toxic exposure, head injury, or substance abuse. And actually in the state of Texas, doctors, the state considers substance abuse as acquired brain injury. I thought that was kind of interesting. Well, I'll just jump off on that really quick. So the actual lasting part that we see, we do identify that people can come in a year later, 2 years later, and go for a tune-up. If you think about learning to ride a bike, once you learn to ride a bike, you'll always have those pathways in your brain, and that's what we do with neurofeedback. But if you don't ride it for 20 years and get back on a bike, you'll probably be a little rusty, and you could use some time riding the bike to get back to where you were. So that's kind of what I talk about tune-ups. There may be a need to do some additional later on, but that's something that we can address then. All right, so Elizabeth, would you please let me open it up for questions, and let's go to that. I'm going to kill this screen because we no longer need it. Stop sharing, and let's go to the questions.
Yes, we have quite a few questions in the chat. One of them, I think, was from the other Elizabeth. What are your thoughts on SPECT SPECT scans as part of an ADHD diagnosis?
Again, back to the diagnosis. The SPECT scans and Daniel Amen, I've been on Daniel Amen for years to publish research on the SPECT scans, and he finally hired a researcher and a Ph.D., and they're starting to do some research there. The problem with SPECT scans is there's really not the research there's no comparative database, there's nothing. It's a lot of beautiful maps and colors and things like this, but it just doesn't, again, the concept of identifying ADHD, which one are you going to identify? There's too many types to say one scan is going to tell you positively that it's ADHD. It may be an ADHD type brain, but there's a lot of causes as we discussed today. I can't hear you.
Sorry. And yes, and Elizabeth had another question. She said, what is a safe time limit for computer game time? Is there a difference between first-person shooter games versus building in Minecraft? I think this is all inquiring teenage parents.
I know it. I know we've been through this. We just had one last month on this, and we could get stuck on gaming again. Let's be logical about this. Anything that is to where your child wants to isolate, don't want to participate in family events. I mean, I don't care if it's a half hour for one child and 3 hours for another child. If you can't get your child off, if you say it's time to eat, no, I gotta get to this next level and all this kind of stuff, it's too much. Okay, we need to really consider it an addiction, and if it's destroying their behavior, if it's destroying their relationships with their family or school, and even in the adult world, I've seen people lose their jobs because they were gaming instead of working. So let's just take it by case basis. I have seen that children that are good in math and music don't tend to get as addicted. I don't know why, but I just thought I'd throw that out there.
Interesting. Well, Savannah had pretty much the same question as what do you consider to be an excessive amount of video gaming? So I think you answered that, but did you want to talk any more about that?
Just about the difference between Minecraft and the first-person shooter game.
Fortnite.
Yeah, thank you. Even though Minecraft is a building type construction game and everything else, nobody that ever was an expert at Monopoly ever became a CEO of a company. And Fortnite is not going to teach real world skills. And the one thing that we're finding that's inhibiting a lot of young people as they try to get into the workforce is they're not used to interacting with humans. They can text, they can send an email, and they look good on paper, but when they interview, they're absolutely ridiculous. They just don't have that kind. So we really need to think about getting them out and getting them socialized. And I know times of COVID has really hurt us there, but that is one of the issues we're facing.
Yes. It seems, and this one is from Megan, and she asks, it seems like the best assessment requires lots of testing. What is the best way we can do for families and individuals who do not have the resources to get all the testing done?
Well, trial and error is what everybody uses. And first of all, and if you go see Barkley at the at the ADD conference, you know, he's all about stimulants. And that's the easiest thing to do. A trial on the stimulant is a first shot at it. The next thing they'll do is they'll change stimulants or they'll add a reuptake inhibitor. The next thing that they'll do is that they'll keep going until they increase the dosage or try the different ones, go through all of them, and then they'll try a non-stimulant, which is like the Antuno, in case they've got like the beta spindle type, you know, brains. But that's what you're subject to. And I'm sorry about the cost of the testing, and that most insurances won't pay for the testing, where insurance is starting to pay for the neurofeedback. I know Blue Cross Blue Shield and United is starting to pay for it, but you know, it's an investment. So, you know, people can do the trial and error, and that's what they've been doing, the guessing game. And if they find that they've tried 2 or 3 or 4 medications, they may just want to put a crowbar in their wallet, pardon the way I put it, but it's really worth it to identify what's causing their symptoms and not just keep guessing. That's the problem. And I'm sorry about that. You know, I wish it was more reasonable, but I use 2 neurologists on my team. We look at every one of these EEGs as an individual, and we're going to come up with a plan specific to their brain and medication recommendations based upon what we find. And this is all, you know, done by MDs, really top of their game people in our industry.
Awesome. This one is from Ruth, and she says, as far as diagnosis of ADHD, does your approach give a diagnosis that could be used as documentation for a college student requesting accommodations through the disability office on campus?
Well, accommodations require psychoeducational testing, and that's not what we do. I mean, there's a lot of places that do it. Elizabeth can tell you a lot of places that can do psychoeducational testing, and they don't care about the funny squiggly lines that I can produce and what's causing it and everything else. They just, that according to the schools, not all, I mean, talking from elementary, pre-K, all the way up through college, they want psychoeducational testing. Now, the great thing about psychoeducational testing is it really provides a good baseline of cognitive functioning. It doesn't identify what's causing the issue. They can add up all the symptoms and put a diagnosis out there, but it doesn't tell you what's causing the diagnosis. But the schools don't care what's causing it. The schools just want to know you got psychoeducational testing, got a diagnosis of ADHD, and here's the recommendations.
Yes, thank you. And there are some really great educational testing places throughout Houston. I'm happy to connect you. We also have another question that says, I have run across a man in Galveston who had a brain machine called, and let me see if I pronounce it correctly, Cereset. So CERESET. Are you familiar with it, and would it be helpful to balance the brain?
Okay, anybody that has any question about anything they hear in the field, write these 2 words down: PubMed, Medline, PUBMED space Medline, MEDLINE. And when you type that in, I'm going to even show you. I'm going to open it up so you can see which one to go into. We'll just do it right now. Share my screen. That would be a concept. Where's my share screen? Okay, you got my screen. Okay. This is the best place to search for anything because PubMed Medline links you to the National Institute of Health database. And so you get into that, and when that opens up, you go down to the one that says home right here. This is what I always use because you can buy an article, you can pay for an article of yours to be published. Those are predatory journals. You do not want that. What's the name of that piece, Elizabeth?
Where's that?
Spell it.
Cerest, CEREST.
SET,
SET.
is that correct?
Yes.
If there's ever been any quality research on it, it will be in here. No, Ceresetto, that's not it. That's a name. Doesn't look like there's any research out there on it, okay? There's probably manufacturer's research, but take that with a grain of salt. Anybody can try anything as an experiment, as an N of one, and some people do get some benefit from things like this. But until it has good scientific studies done with it that says it's acceptable, or it's at least is something that's got potential to help, I just stay away from it. I can't comment on it. So, you know, but always go to PubMed Medline and look for the research and what they're saying. Maybe, and if you look at their manufacturer's research or look at their, you know, in their website, you can get other possible things to search in PubMed Medline. But always go to the National Institute of Health, because only good quality journals get into that library, and that's where I do all my searches.
Great information. This question is from Carol, and she asks, are there any data on incidence of ADHD in people having different cultural or ethnic backgrounds?
You know, this cultural diversity, and we got to look at this all the time. The expression of some of the, you know, certain cultures are more expressive vocally, are more animated vocally. I think they could be possibly overdiagnosed with ADHD because they're different than the person who's doing the testing on them. But I know as a brain, and I've studied, you know, well over 4,000, 5,000 brains. It's something that I don't see there's a cultural difference in brains itself. Maybe the exhibition, I mean, how their symptoms are exhibited may be a little more pronounced or a little less pronounced. That's why boys, you know, why they're diagnosed more with ADHD than girls? Because they're more obnoxious by their nature. And they're the ones that get the teacher saying, you got to get this kid on medicine. So, you know, the girls that are just sitting there kind of being distracted, they don't bother anybody, so they get not diagnosed. So there's the differences I see more than anything else.
Yeah, that's interesting. Are there, this question, sorry, is from Dawn. And as far as diagnosis of ADHD, does your approach give a diagnosis that could be used for documentation for Social Security disability listing?
No, getting SSI on a person, Social Security Disability Insurance, or whatever, SSDI, that's very difficult. Usually you have to get an attorney. It can help support some of that information, especially in regard to some severe brain injury. I do cases right now with traumatic brain injury from car accidents and stuff. And yes, that can help support it. But just because I've got a funky brain on my EEG and QEEG, they're not going to look at that though, because they need the whole picture. How is this person disabled? Not just looking, it's kind of like taking EKG. Will an EKG help you get disability? Probably not, you know. But if the person can't walk up a flight of stairs or something like that, pick up more than 20 pounds, yes, that's going to get into Social Security disability.
Okay. What is your experience of depression presenting with ADHD in adults and treatment?
Well, depression, there's a type of depression, mood regulatory issue with the anterior hypercoherent alpha. So we can often see affect regulation issues coincide with, which could be, you know, depressive mood. More about the agitated depression, and that would be something that we could see coexist all the time with ADHD. Now, there is a refractory depression that has to do with focal slowing on the left anterior temporal lobe. That's why the TMS got indications, approval from the FDA to do a course of therapy on people who have failed 3 SSRIs, and then the insurance would pay for But what I do is when I find somebody with that focal slowing, they failed 3 SSRIs, I refer them downstairs um, uh, to the TMS lab that I've got in this building, because if insurance is going to pay for it, let's let them pay for it. But that focal slowing in that left anterior is a common finding in the brain that's linked to depression.
That's great. As an LPC associate, do you have any book resources you would recommend that would provide me with good information about ADHD to better help my clients?
There's a book out by Daniel Amen. I have it somewhere in my library here. Where is it? See Daniel Amen's book over there? But that's a real good one. Barclay's written some books. The person
I was going to say, you can go see someone really great next weekend.
The person you need to ask that is Pam, because they've got books at the conference.
His Taking Charge of ADHD is just a good overall book, and he has many. And I know we just are about to send out a link that will have a lot of his books on it, because we can't obviously sell them. We're not in person like we usually do, but we do have a small bookseller that's accommodating us, so they're easy to get. But his is a very popular one. And then for adults, a lot of people still like Hallowell's, what is it? Answers to Distraction, or maybe that's the second.
Driven to Distraction? Is that
Driven to Distraction, yes. And so if you're interested, email me, because obviously we've sold books a lot. And so I've got quite a few, even for kids, that would be of help.
And just to add to that, when we wrap up today, you are going to get, because we've gotten a couple of questions about this in the comments, you're going to get links to all of the hosts for today to their websites, along with the presentation and the recording link. So you will leave like with a wealth of knowledge, I promise you. And that is, of course, if you registered for this event. If you got the link from someone else, it might be a little bit difficult to get it to you, but we want to make sure that you're left with tons of information. We have a couple more questions, and I want to make sure we're good on time. Could you comment on vocational handicaps related to ADHD, barriers to certain career fields?
I can tell you about the career fields for ADD persons: military, fire department, police department. You have to be able to multi-focus. ADD brains do not do well in boring jobs. That's just in our nature. We have to have some sort of challenge. We have to have something that's, people who, if it wasn't for ADD, Columbus would have never discovered, the New World, because he would be too afraid. Only an ADD person is going to go out one direction thinking he's going to sail off the end of the earth and still keep going. So, you got to think about those jobs that take a lot of challenge. They're varied, they're not repetitive, and that's the ones you would most likely want to focus toward. And yes, in certain jobs that are not that way, the ADD person will usually not thrive.
Okay, I just want you to know this question is from user. I did not pose this question.
It's from who?
You recommend for elder folks that are starting to have memory loss? Testing, nutrition, elder.
Okay.
It's for all of us.
What is the exact question, Elizabeth?
That is it. What would you recommend for elder folks that are starting to have memory loss?
All right. If you have a fear of Alzheimer's, if you've got Alzheimer's in your family and that kind of stuff, and you're starting to have some memory loss, I would recommend coming in right away and getting an EEG so we have a baseline. We know by the studies done by Eroy John out of University of New York Medical Center up there, that when the brain peak frequency alpha drops below 8, it's about 2 years they can predict that person will be institutionalized. So the further you are away from 8, the better it is. We have found that I had a 76-year-old female having some memory issues, and she came in the spring. had an issue with drinking a little too much wine. She was clean for like 10 years and then went on a boat trip and then got back in her wine. And we found her at her peak frequency alpha was about 8.25. She's 76. That's not that unusual. It's not below 8 yet. And we were able to speed her up to 8.75. We did 2 sessions a day, 5 days a week for a month, and we gave her a half a cycle per second, which cognitively that's a big boost at that age. So we probably set off the dementia maybe 5 years, postponed it. So we want to do some research in that area, but anybody that's got fear about dementia or memory issues setting in, there's a lot of things that can cause memory issues, the same way as ADHD. We just need to take a look. Is it a neurological issue? Is it a biological issue? Or is it a behavioral issue? So we'll just take a look at that from that perspective and try to figure it out. But anybody that's got a lot of Alzheimer's in the family and is worried about it should come in and let's take a look at their brain. And at least we got the baseline. And in 5 years, we can take another snapshot and see what, and then project the rate of decline.
Great. Can certified vestibular, cannot say that word very correctly, neuro rehab physical therapy specialists be helpful to individuals with ADD?
I don't know. Again, you're looking at ADD as a single diagnosis, yes, but it's not, maybe they can help with some forms of it, as in the ones that have traumatic brain injury. So possibly in that area, but I don't have an answer. I'm not familiar enough, and I don't know how manipulating the person's appendages would help unless you're trying to reprogram the brain with something that's been done, lost in a stroke or a head injury.
That, I think, appears to be our last question. So,
well, one of the things I did want to bring up before I left, I didn't even tell you where I was from. I'm Dr. Ron Swanson. I've been here since 2003 in this area. I worked for the Tarnow Center for 17 years and just started the Houston Neuroscience Brain Center. And the reason we call this the Neuroscience Brain Center, because we continue to do research and publish research and do presentations. I think this is vital when you're on the leading edge of medicine to publish and present. And I've got a team of young ladies that are between their masters and their doctorate, or between their bachelors and their masters, that are working as research assistants. And I've trained up a cadre. Eventually, I want to expand and have more centers throughout Houston and different area locations. But one of the other things we're getting into now, thanks to COVID, if you can thank COVID for anything, is Zoom. This is a great way to get a hold of people without having upset their day. And number two, neurofeedback home training. So we have actually got equipment that we can work with people. And I don't do it with everybody, because ADD people sometimes aren't that good to follow through, but sometimes they are. But we, that could be an option for somebody living out in the Woodlands or in Pearland, and driving in twice a week is just too difficult. So we'll find a way to help any way possible. So I do appreciate everybody for being here, and I'm going to close it and turn it back over to Elizabeth and everybody, because I just love this. And we've got, you want to tell them about our next one?
yeah, so I was going to talk about our next series. So this is a series event. So we'll be hosting these once a month. And so we're going with your heart and your brain. Next month, we want you to be a part. And if you have more questions, or if you feel like you would like to learn more, again, email us back. We'd be happy to answer them for you and get you the right connections, or save the questions for our next speaker series as well. And feel free to share these events with your friends and colleagues. We'd love to have them attend. The more, the merrier. And we just really appreciate you coming out today. And we look forward to seeing you next week at the Russell Barclay event for the ADA. So have a great day, y'all.
And post my email up to everybody. So if they want to ask questions offline, just email me, guys. I'll be happy to answer your questions.
Yes, we will, when we send the email with all of the PowerPoints, we have all of that on there.
Great.
Thanks, everybody.
Thank you, guys.
Appreciate it.
Attending.
Bye-bye. That was fun.
That was a good one.
I think
Nice
we
turnout.
We saw 44 total, didn't we, at the highest? I was looking at?
45 at one
45.
point.
Okay, so, and there were several people who asked for the recording, so we'll just need to go ahead and send that out, I guess.
Well, we have to find a Dropbox ability to do it and load it to the Dropbox, I guess. That's the only way I can see, but it's a gig probably. Okay, we'll figure that out.
Okay, guys, let's talk soon.
Okay.
Take care.
Thanks, ladies.
Bye-bye.
Bye-bye.
Okay, we need to get a